Welcome to Follow the Medical Record, where healthcare experts give insights into the increasing importance of following a patient's medical record through the health ecosystem with compliance, privacy, security, and efficiency front and center. This podcast is brought to you by MRO and hosted by Don Hardwick, Senior Vice President of Client Relations at MRO. Don has been in the health information management industry for over 40 years and has extensive knowledge of how medical records make their way through the healthcare ecosystem. At MRO, Don is responsible for strategic client engagement programs and overall client satisfaction. To hear from all of MRO's industry experts, be sure to visit mrocorp.com for additional content and to sign up for our monthly e-newsletter. Over to you, Don.
Hi, everyone, and thanks for listening to Follow the Medical Record. I'm your host, Don Hardwick, and you can learn a little bit more about me and MRO on MRO's website at mrocorp.com and can connect with me on LinkedIn. Also, be sure to follow us on Twitter at MROCORP. On today's program, we'll be talking to Dawn Crump, who's the Senior Director of Revenue Integrity Solutions at MRO, about the significant increase in audits, and more specifically about clinical claims denials. Denials is a huge topic in the healthcare industry, and so we'd like to unpack a little bit of this today and see if we can shed some light for our listeners. So welcome, Dawn.
Thanks, Don. Happy to join you today.
Absolutely. Dawn, before we get started, can you tell our listeners a little bit about your background and more specifically your current role at MRO?
Sure. So, I spent the majority of my career kind of growing up on the hospital side and really working within revenue cycle process improvement and compliance and managing government audit and denial, specifically back when RAC was in its heyday, which it's all of these different pieces combined to really having a holistic view of how these audits impact an organization, whether it's on the financial side, whether it's compliantly, or whether it's in education back to your teams to try to prevent that. So within my role here at MRO, I'm really excited to be the Senior Director of Revenue Integrity Solutions. And now we have the opportunity to really combine services and our software offerings around not only capturing and managing external audits beyond government, but commercial and everything, but internal compliance audits that are so that we can become more preventative and enable providers to retain that revenue that for all that care that they've provided to the patient. So we're in a really good space right now, and we're excited about being able to offer more revenue integrity solutions to our provider partners.
Thanks, Dawn. I want to unpack the internal concept in a few minutes, but before we delve into the internal piece of it, what's driving the increase in these audits versus, let's say, 5 or even 6 years ago? And beyond that, why so many claim denials, clinical claim denials these days? And let me just add, I don't mean to throw all several questions at you at one time, but how financially impactful are these denials today for hospitals in particular and providers?
Yeah, so let me kind of go back to the first one and why we're seeing increases. If we go back a little bit in time, this really all started with the recovery audit contractors or the RACs back in the heyday, and these were focused on Medicare claims and remits and trying to track those improper payments. Well, what's driven off of that and why we're seeing increases today, while the RAC volume has decreased due to some changes in the statement and work, we're seeing other payers and other contractors who are going in and looking at managed care claims and commercial claims. And there's actually an entire new business around auditing provider claims. And out of that analysis has then driven some of this clinical claim denials, because now they know, now these payers know where there's gaps or there's potential improper payments, and analytically they can go in and put some conditions of payment around some of those areas where they find that improper payments are more likely to happen. And so, that's really why we're seeing the increase. We're seeing more people who are in this game besides government auditors now. So it's across all your payers. And they're utilizing that information to start shifting to conditions of payment, and kind of a burden of proof is on the providers now to ensure that they've appropriately billed in order to get their expected reimbursement.
Is that where the more, just the quote, more likely to happen, is that where the internal audits are helping to prevent those occurrences of denials based on parameters or data that would raise a red flag with the payer?
That's where the internal audits help you really identify your risk. You want to identify your own risk prior to some external auditor coming in and looking at it. So that's really how they tie together, or it could go both ways, but either way it goes full circle. So if you're getting audited and denied on a specific area or a topic from an external auditor, then you should be working with your compliance or your internal audit team to ensure that they're monitoring that and determining the root cause, and then following through on that education so that you can start preventing those that financial take back. These, and I'll go back for 1 second and touch on the financial impact of the denials to hospitals, and just on that clinical denial. Sometimes hospitals are denying are receiving these denials on 7 to 10% of their overall revenue, which is extremely impactful. And then as you start to dive it down, for a small hospital, that could be upwards of $3 million annually. So in these times when managing that revenue and retaining it is so important, it's really important to look holistically at not only your clinical claim denials, but how that matches and mirrors your external auditing outcomes as well.
So Dawn, kind of walk me through here the billing cycle itself, and show us where there may be opportunity in here, or is it all diagnostic driven? So if you can, just for our listeners, kind of walk us through the billing cycle in general of the process.
Sure. So when a patient is discharged, you're working, and I'm going to keep it very high level for now, but basically, you've provided services. It's time now to bill that payer for the services rendered. Sometimes, if it's a commercial payer, we start to get into different conditions of payment, and that means the payer has said, for this type of service provided, we expect you to provide this type of documentation before we will pay. So that's kind of that first step in the process that might impact whether you're going to get a subsequent denial or not. Because if you don't submit that expectation of what their condition is, then it's going to cause a denial. But what we're also seeing, so then the next step is you have teams, then you either get paid or you don't. And if you don't get paid, you have teams within the revenue cycle, follow-up teams, cash posting teams, things like that, who are monitoring whether they've gotten paid, if they've gotten paid timely, and if they've gotten paid the expected amount that they would, that's contractual, if it's a commercial, or based off of what was actually billed and what was coded. So you've got those teams that are following up. And then on top of that, you have some dedicated denial teams that will come in and work those claims and find out where that's at. Now, what starts to, where there's a disconnect or possibly an opportunity to some low-hanging fruit, is not all of these teams, they might be working out of a PFS system, but you might be getting audits that are coming in through other areas of your organization or other areas within rev cycle. So making sure there's not duplication, making sure that you understand why those clinical denials are coming in, and that you're doing as much as you can to be proactive. And I say that because, the one key criteria around clinical denials that's similar to audits is almost every single clinical denial is going to require you to submit either a complete medical record or portions of the record so that you can so that the payers or the auditors are validating that the documentation within that record for that encounter matches what they expect it to be.
So it sounds like there's two approaches. One, obviously, in retrospect, when a denial happens and the hospitals are clear that they are deploying resources to dig into what that delta is. Dawn, most of the time it's not a complete denial, but it's a partial denial, correct?
Yeah, you do see a lot of partial denials or, and that kind of, triggers into, coding denials are one of the top denials that hospitals may see, and they may not always be a complete and total loss of revenue. It may only be a portion based off of how the codes changed. So, it does vary, and it varies by payer and by provider. But sometimes it's a partial. Sometimes it's a difference in what was the expected payment versus what was actually paid, and there's various reasons for that.
So two complete different avenues, one retroactive review and then one proactive audit process. How open are the payers or the external auditors in communicating what they're looking for so that the hospitals know how to target these types of claims or diagnoses or types of patients that are coming into the facility? Could be, cardiology as a general topic or orthopedics as a general topic. But how are they the external auditors or the payers? Are they open to working with the hospitals on the criteria so they prevent these audits?
I would say that varies, and I think there's still opportunities for some of that communication to increase. So some payers are very thorough in their explanation as to why it's denied, but there's still a back and forth discussion. It's also in kind of the expectation and the reason that you're denying things. But I would say that as you start to go into larger volume of denials on the same topic or the same issue, then those conversations should be had, and you should be including your managed care team in some of those discussions. But it really, that is one of the challenges across some of this, as the commercial players have really driven into, making a much more robust auditing or payment integrity program, is all of them vary. It's not the same across payers, and sometimes depending on the payer who you're talking to, or whether it was a prepayment audit versus a denial versus a third payer auditor that they've contracted with, you might get 3 different answers when you ask them. So it does cause additional challenges as these programs continue to ramp up, because every payer is different, and even within their organization, you might have different contexts.
Dawn, you mentioned prepayment audits. Tell us a little bit more about the concept of prepay audits.
Yeah, and prepayment audits are just what they sound like. As a payer or as a provider, you're submitting that claim, and it triggers some kind of algorithm within the payer's system that says, hey, we're going to audit this for prepayment. Maybe it's because they found that there's been a lot of subsequent denials that haven't been appealed previously. And so those prepayment audits, now they're shifting, and they're going to, they tend to get directed to your business office teams or your PFS teams. And it's a challenge because now typically HIM isn't always involved in that and doesn't realize that these records are going out the door to support a prepayment request. It also impacts the hospitals because now it's aging their AR. I mean, you typically have 30 days to submit a record, and then the payer has another 60 days. So now that account is aging 60, 90 days easily before there's a decision or a payment on it, when typically those payments are expected within the first, 21 days after that claim or that bill is submitted.
Dawn, this has got to impact when you extend this AR out. This has got to be extremely impactful financially to a hospital. I know in general, the public believes that hospitals make money hand over fist because they see, some of the billing side of that personally for, treatment that they've received or their families. But in actuality, hospitals are in the low single digits of margin to operate with. And so yeah, it's got to be extremely impactful to move that AR and extend that AR in order for the audit companies to do their work and for the response back and forth versus how it has been in the past where they got paid and then, recouped if there was some type of recoupment based on their findings of the audits. So how do you see this working for hospitals and their financial stability as we shift to prepay?
Yeah, it's all the things you said. I mean, I think it is going to become more of a burden as more and more payers shift to this prepayment model. There's only a couple right now who are really hitting the prepayment and have a good, strong process on it. But I expect this to continue to grow. And as it does, you're right, those margins are going to get tighter and tighter, as well as, hospitals have requirements to have certain days of cash on hand, and it's going to start to impact that as well. So financially getting a handle on this is one challenge, but that's where the whole, managing your internal and identifying your risk and putting operations and procedures in place for those things that you're really getting denied on, or having those conversations with your managed care team and trying to minimize the ability for prepayment audits and minimize the volume that they're able to request in a certain time period is going to be critical to start to managing this flow.
Dawn, I've heard from different hospitals in different discussions here that if they were not managing their denials very closely, it would strain their ability to stay in business. So that said, and some of the shift to prepay, what advice would you give to either the departments that are managing these audits, the business office, claims management in general? What advice would you give to these departments to focus their attention so that they can prevent the denials and reduce the amount of audits that are occurring, because it is so voluminous in these hospitals today and time consuming that it is eating up a lot of human resources that otherwise in years past didn't exist. You didn't eat up those resources. So your cost of labor and cost of operations were lower than they are today. So repeating the question here for you, I know you may have gotten lost in there, but what advice would you have for our listeners?
Yeah, I think there's a couple of pieces of it. I mean, one is, really know what your risks are. So that's that internal piece, but it's also combining that internal with what's currently happening from those external audits. Where are your denials? where are your external audits, and what are the outcomes of those audits so that you can start to become preventative and monitoring those things. The other is, remove some of those silos. You've got within your organization, you typically have people who are managing audits in one department, and they're mostly post-pay or government, and you've got commercials in another department, and they're not really talking with each other and comparing that information. And then you have compliance who's maybe working some different things. So it's really an opportunity to come together and look at where all that information lies, what the processes are, and better align so that you can get a more holistic view of the impact of these types of clinical claim denials, as well as your audits, whether it's prepay, post-pay, commercial, or government. So come together and build that. And then the other thing is really, if your organization is of decent size, map that workflow and process and figure out where you can centralize those resources. Resources are at a minimum right now. Where can you centralize those teams so that you can create those best practices, so that you can create that knowledge base and address and respond to things quicker? And then, look at your vendors that you're working with, like MRO. Where are there opportunities that we can assist you with aligning some of these different workflows and processes? Because you're not on your own. You have people in your organization already, and you have vendors and vendor partners like MRO who have expertise and resources who can help get you to that next step.
Well, Dawn, this is very interesting and something that every healthcare facility in the country is faced with, of managing these denials. So I really do appreciate you taking the time out of your busy schedule to join the show today. So thank you again very much for joining us.
Thank you for having me, Don. Anytime.
And for more insights on a patient's medical record through the health ecosystem, visit the show's homepage at mrocorp.com. And be sure to explore additional resources and thought leadership on that site. You can also check out our program on healthcarenowradio.com. Finally, be sure to connect with us on Twitter at MROCORP. Until we talk again, I'm your host, Don Hardwick.